I came out of retirement for this.
There's a lot of people who've really stepped up to the plate.
I feel part of a bigger community.
Everybody's so excited to be here.
Within my groups, everybody volunteered their time.
So you have your card. Is this your second time?
Yes.
Congratulations.
Thank you.
Card of honor.
As it became an idea or a thought that potentially there could be a COVID vaccine, Dr. Jeannie Mayer reached out to me because I'd worked with her on the H1N1 pandemic years ago. And she's like, Kavish, I want you, Phil Chafee, Colleen Connolly, and a couple others just to start working on this. And she mentioned, what else do you need? I'm like, well, let's get Dustin Banks involved, and let's get Cynthia McCumber involved, and get a few other folks that we know that just know how to drop everything and pull off something like this pretty quickly. We didn't want to wait to have the perfect space available. If I waited for this space to be available, I'd be waiting 5 or 6 days. We were able to get space set aside for getting the first 4 or 5 people vaccinated, and then that night vaccinated a couple hundred people. We were up in the MICU vaccinating all night long, getting the frontline staff members. So the relief that all those things were working and that we were able to get it out as quickly as possible. We saw the places, try to receive it and then plan. We had a plan in place as we received the vaccine to go ahead and start vaccinating right away.
When I was involved was the first day that the vaccines were happening out in the tents. What we learned very quickly is that the people that were coming down, one, that they were very excited, but then the other side is that it started creating a problem, and that was a line. We saw at some points more than 100 people per hour, and in a very small amount of space that was very difficult to orchestrate. So our team was able to mobilize very quickly to help with making sure that the lines were constructed in a way that people weren't actually creating their own event and becoming more populated than we needed to. Moving in here really was a great experience, simply because of the facility and engineering group being able to turn this spot over very quickly to us.
A little over 3 days straight to get the space ready for us, and it's absolutely incredible. We've got 17 exam rooms, so we can administer up to 17 vaccines at a time. We have a nice, great little compounding space in the back. We've got great space for our staff to get checked in as they come in for their appointments and then get scheduled for their second appointments.
Nobody that has been working in the clinic is here because this is their job. Within my groups, everybody volunteered their time.
We had an amazing turnout of volunteers. I was able to tap into my director, Kathy Dellis, was awesome and helping us get volunteers from all over the organization. We had directors from finance, decision support, we had managers, directors from revenue cycle support services, we had folks from dermatology join, we had staff and leadership from radiology come help us out. So it seems like I couldn't keep up with the people emailing me and contacting me and saying, how can I help?
I came out of retirement for this. I retired from the university in July of 2020. I had done GI for 18 years. When it came to the vaccine coming out, and I thought, they're going to need nurses and people to immunize, and I can do that.
I'm one of the clinical staff educators over the ambulatory clinics in the central service delivery area. And we got the email that they needed volunteers. My manager sent it out to us, and it seemed like a really good opportunity to help and something that I want to tell my grandkids about.
I'm excited about it. I love being here with everybody. The employees are just, everybody's so excited to be here. We're all, number one, it's nice to get out and actually socialize and feel safe.
Selfishly, I enjoy being in a spot where everyone's kind of excited to be coming in here. Normally I'm working with patients that are upset about their care, so it's kind of a nice break.
Yeah, actually I've been really impressed with how organized it's been, as far as all of us getting emails, keeping us up to date on what's going on, how much help they need, and I've been really impressed how efficient everything's been.
What I'm seeing is it's a team, and it's been very rewarding to see that.
I think there's a lot of people who've really stepped up to the plate, kind of moved outside of what their maybe day-to-day operations were.
We're more than willing to help out because we have good management.
Everybody here is just pulled together and has done 110%. Even with the organization of this clinic.
I feel part of a bigger community.
Well, it's just kind of nice to give a little bit, we work here, everybody kind of has to pitch in a little bit to help out, and just kind of makes you feel like you're doing your part.
We're just here to support each other no matter what we need.
If you want to see people happy, come stand in line. You'll see people, smiling, taking selfies, getting excited about getting the vaccine.
We're all in this together. We're all going to get through this together. And I see the light at the end of the tunnel. It might be a long tunnel, but there's a light, and we're a team.